Hello, my name is Alexandra, and this is the second video on my assessment. We'll be assessing the neurological. We're going to be doing the mental status exam on my patient today. The first thing that we're going to do is observe the patient's dress, grooming, and hygiene. When you first encounter the patient, this is the things that you're gonna be looking at. You're gonna look to see if your patient is clean, they're appropriately dressed, they're groomed well, they don't have any poor hygiene such as body odor, some abnormal. Some things that could result in poor hygiene could be dementia, or or the patient just has self-care deficit because they're not taking care of their hygiene. So my patient, as I'm looking at her, looks groomed, well groomed. Her attire is appropriate. You also have to look when you're looking at attire. You also have to know their culture, if their clothes is culturally appropriate. So once we've observed the dress, grooming, and hygiene, we're gonna look at the level of consciousness of the patient. We will know if the patient is alert, oriented, awake, or responsive. Some of the things that we can ask to see if they are alert and oriented, we could ask their name. Can you tell me your name?
My name is Margaret Joseph.
Okay. The other thing that we can do is we can ask the date, like different things to find out if they are alert, if they're oriented, to determine their level of consciousness. You basically interview the patient to find out if their responses are appropriate. If they're responding in a timely manner, if you ask them the day or the time that they're giving you the right information. The next thing that we're going to do is going to assess the behavior and posture. So when the patient comes in, you're looking at their behavior, you're looking at their posture, their body movement, their facial effect. You want them to be relaxed. You want them to be erect. So my patient looks relaxed. She's sitting straight. No signs of anxiety or no bizarre behaviors. You're checking to make sure, like your patient doesn't have, let's see. You're going to check to see if the patient is not angry or mentally ill or violent or anxious or fidgety or restless. If they're crying, it could be a sign of depression. Just different things that you yourself you feel would be abnormal, or it's not typical of a patient that comes in. The next thing that you're going to do is observe your patient's facial expressions. As you talk to the patient, you're looking at how their facial expression, how they express themselves, if they're making eye contact, if they're smiling, if they're frowning when it's appropriate. And you have to also look at cultural. Some cultures do not. Some cultures are not one where they look at people in the eyes when you're talking to them. So they may be looking down. That could be normal. So you have to look at you have to take note of their culture too before you say, oh, it's abnormal because they're not looking at me in the eyes. So once you're done looking at their facial expression, to determine if anything's abnormal, so abnormal results would be like, for example, patients with Parkinson's disease may have mask-like expressions or no expression at all. They may stare. Staring watchfulness appears in metabolic disorders and anxiety. They may be smiling in a situation where they should not be, where it's a sad situation. So, which could be an indication of mental disorder. So you have to look at these things when you're assessing or observing your patient. You have to look at the pattern of speech. You want the speech to be moderate in tone, clear. You want it to be moderately paced and culturally appropriate. In older adults, responses may be slowed, but speech should be clear and moderately spaced. Loud, rapid speech may occur in manic phases or people with bipolar disorders. Disorganized speech or consistent non-stop speech and long periods of absence could also be a sign of disorder. So as you're talking to your patient, you're noting all of these things to see if there's any abnormalities. So the next thing that you'd be looking at is their mood, feelings, and expression. So you would assess this by asking the patient things like, how are you feeling today?
I'm feeling good.
Perfect. So you ask them how they're feeling. You can ask them their plans for the future. And as they're answering your questions, you note, their expression. If there's any signs of, their mood. If what they're saying is not consistent with their facial expression, you would know all that to determine their feelings and their mood. The next thing that you would look at is observe the process and perception. While talking to your patient, you want their thoughts to be free-flowing. You ask them questions that you expect realistic perceptions. You want the patient to be easily understood, and you note if there's any suicidal thoughts. And you can ask, have you thought about committing suicide? So these would help you with the assessment of their thought process and their perception. Okay. You want your patient to verbalize positive, healthy thoughts about themselves and about their future. Clients who are depressed and feel hopeless are at higher risk of suicide. So you definitely have to look at that when assessing your clients. Okay. The next thing that you're going to look at is observe for cognitive abilities. You want to make sure that the person's oriented. Like I've said earlier, you ask them for their name, and my patient already told you her name. You can ask them for a family's name. You can ask them for the time. Can you tell me the time right now?
The time is 8:53.
Okay, and you can ask them the day, the hour, season, things like that to determine if they're oriented. You can test for their concentration by asking them to do simple tasks like, for example, can you hand this, can you put this marker to your right hand, or move it over to your other hand, and then hand it over to me. Okay, so simple tasks like that will determine if they're focused, if they can stay attentive, like as you're talking to them. Are they focused on what you're saying? They're not off in space. You can test their recent memory, like by asking questions like, "What did you eat today?"
I eat fish and rice.
Okay.
Beans.
Okay, so she was able to recall what she ate earlier today. You test remote memory by asking things like, when did you get your first job? What age did you get your first job?
When I was 23.
Okay, so 23. So those test the cognitive abilities of our patient. Okay? So that portion's done. We're going to move on to the next one.